Welcome to Logical Ayurveda. So today we are going to see about Gandha Thailam. In last video, I have explained in detail about the benefits of Shirabala and where to use an exact specific condition as to how to give Shirabala to the patients. Today we are going to discuss about Gandha Thailam and the difference between Shirabala and Gandha Thailam and what and when should be administered both. So what is the main difference between Shirabala and Gandha Thailam? Imagine a patient coming with you who is doing hard physical activity, strenuous physical work. Imagine you're a doctor who is working in village or suburban area where the dominant patients are doing excessive physical activity, thereby degeneration and thereby Dhatukshaya, causing the Vata Prakopa, causing the knee pain. So Dhatukshayat Vata Prakopa, the first medicine that has to come to your mind is Shirabala. So now where to give Gandha Thailam? You already have Shirabala and Dhatukshaya Vata Prakopa. Gandha Thailam you choose in such patients who is having mild to moderate to severe obesity. Because of obesity, because of increase in weight, there is bone degeneration and the patient does not do strenuous physical activity. The patient is having a sedentary lifestyle and the Vyadi and other conditions where the Vyadi is specific to Asti Dhatu. Because they are overweight, patient is overweight, because the patient is having Kaphavarana, thereby Vata Prakopa, thereby bone degeneration, you should automatically choose Gandha Thailam. So this is the specific distinction between Shirabala and Gandha Thailam. Those who work hard, those who does not work hard, Dhatukshayat Vata Prakopa, Avaranat Vata Prakopa, one is not having cholesterol, one is having excessive cholesterol. So this is the place where you have to choose these two specific particular drugs. So another condition is when the patient is having fracture, does not matter which patient it is, when the patient is having Bhagna Roga, whether he is obese or Krisha, does not matter, Gandha Thailam should be first drug of choice. Not choosing Gandha Thailam in fracture is a crime because it is an excellent Asti Dhatu Brahmana. So coming to whereas Shirabala for that say is not very specific to Asti Dhatu unlike Gandha Thailam. So how is Gandha Thailam prepared? What are the contents of Gandha Thailam? In Gandha Thaila, mainly you have sesamum seeds, tila seeds, which are soaked in water for 7 days and taken out. And then it is soaked with a mixture of Eshtimadu Kashaya and milk for 7 days. Why it is soaked in water for 7 days? Why it is soaked in Eshtimadu Kashaya plus milk for 7 days? Because tila is extremely Ushna. So to pacify in Ayurveda, always a drug will contain an aggravating agent and a subsidizing agent. If there is something that increases Ushna, there will be always a counter-affecting drug within that medicine not to give the side effects. So similarly, because to neutralize the tila, Ushna Viryatha of the tila, it is soaked in water for 7 days and it is soaked in Eshtimadu Kashaya and Shira for again another 7 days. And it is also mixed with Padmakadikana and Yeladikana and a lot of Prakshapaka Dravyas like Rasna, Durva, etc. And it is with all this combination, Thaila is made and Gandha Thailam soft gel capsules or drops are prepared. So, in spite of doing all this, in spite of pacifying the Ushna Viryata of Tila this much, the Gandha Thailam drops or capsule is still Ushna to the patient. Still it causes urinary tract infection to the patient who are already having gastritis. It will increase gastritis. So you have to be very chooseful, very highly cautious while choosing Gandha Thailam. I always prescribed Ulcerex tablet of Charak company along with Gandha Thailam because it has some pacifying property. It neutralizes the Ushnata of Gandha Thaila. Or you can also choose Gulichadi Kashaya along with it, or Bala Gulichadi Kashayam and Kamaduga Mukta tablet, anything of your choice to pacify the Ushna Virita of the Gandha Thailam. The benefit of Gandha Thaila is that it does not need much Agni for the patient to digest because it is given in Avarana, because it is given in the patient with rich ama, with cholesterol, etc. Where there is extremely high ama like fever, Gandha Thailam should not be given. But normal ama, with patient with normal ama, Gandha Thailam will not increase the will not decrease the Agni so much like Shirabala. That is why Shirabala, the side effect of Shirabala is that it is difficult to digest. That is why we give it with Dhanvantram Guliga and Talisadi tablet. The side effect of Gandha Thailam is that it will increase Ushnata to the patient. So that is why we are prescribing some pacifying agents or anti-ulcer agents along with the Gandha Thailam to neutralize the Ushnata of the Gandha Thailam. So coming to contents, the Tila is the main content here. What is Tila capable of doing? It has excellent cholesterol reducing capability. whenever you go 20-30 years back in villages and all, when the patient is having PCOD, when the lady is too much, when a woman is not menstruating for so much time because of PCOD, when she is overweight, the only thing, the main things they will ask to take are tila and papaya, Ushnavirya Dravyas, like that. Why they advise that? Because it reduces fat, it reduces cholesterol, it increases metabolism, thereby it corrects the cycle, it reduces the PCOD, and then thereby increasing Ushnata, causing the proper menstrual bleeding from time to time. In fact, Tila Modaka is given daily for that cause. And we have medicine called Tila Rasayanam in Ayurveda we give to PCOD patients. So the crux of this thing is, it has an excellent cholesterol reducing property. It has excellent Kapha Varna reducing property. It has fat burning capability. So that is why Gandha Thailam can easily surpass directly to Meda Dhatu Agni. When you take Ksheerabala, it has to be digested, go on to Rasadhatu, Raktadhatu, Mamsadhatu, Astidhatu. Mamsadhatu, Medodhatu, and then Astidhatu. But Gandha Thailam is not like that. You take it, it has capability of directly acting on the Meda Dhatu Agni, giving the Brahmana to Astidhatu. That is its Prabhava. It can directly act on Astidhatu. Why else it would be given in fracture? In first day of fracture only you give Gandha Thailam. How can it create a bone Brahmana? Because by Prabhava of it is Asti Janana property is there in Gandha Thailam. So, you should understand how Kapha Varna Vata patients come. Okay, you can take an example of a dam where one side of the dam is full and the dam gate is closed, other side of the dam is dry. Why the other side of the dam is dry? Because the water is accumulating on the other side. One side, the gate is there, only when the gate is open, the water can reach the other side. Similarly, for the patients of obesity, for the patients of Kapha Varna, there will be all the nutrition in their world, there will be all the weight in their world, but it won't get proper digestion. They will have sedentary lifestyle, they will have impaired Medo Dhatu Agni, their metabolism will be so low that the nutrition does not reach, because of the Ama, the nutrition does not reach Asti. So such is the exact condition where you choose Gandha Thailam, where it gives miraculous results. So you choose it in Kapha Varna Vata Prakopa. So in fractures, along with I big time I am using Gandha Thailam along with Mustadi Marma Kashayam, Lakshadi or Kaishara Gugulu, and Murivanna for external applications. This is commonly used. This is the place where I use Gandha Thailam along with all these adjuvant medicines. In knee joint pain, I use Gandha Thailam. When the patient is coming, the patient is having if the patient is having Shofa as a main symptom, I choose Rasna Saptakam, Amruta Guglu or Gokshara Guglu, and then Gandha Thailam according with it. If the patient does not have much of Shofa, I choose it with Maharasnadi Kashayam, Kaishara Guglu, Gandha Thailam, etc. So it depends on the patient, along with the calcium supplements, external applications, etc. In frozen shoulder or cervical spondylosis or in any Urdhva Jatrugata Vyadhis, I choose Gandha Thailam along with Ashtavargam. Why Ashtavargam? Ashtavargam Kashayam is excellent in increasing blood supply to the particular part of the body. It will make sure that the Gandha Thailam is specifically reached over there. So I choose it, and it has some Urdhva Jatrugata properties. So I choose it with Ashtavargam. For example, a frozen shoulder patient comes, I choose Ashtavargam Kashayam tablet, Kaishara Guglu Gandha Thailam. Some cervical spondylosis patient comes, I choose Ashtavargam Kashayam, Panchamrita Loha Guglu, and then Gandha Thailam. So such kind of choosing along with the adjuvant medicine according to the condition I do. So in calcaneal spur, I give Gandha Thailam along with Rasna Saptakam and Gokshara Guglu and some external application. Even in ankle joint pain, plantar fasciitis, I give Rasna Saptakam, Gokshara Guglu, Gandha Thailam according to the condition, and I ask the patient to take it for 3 months, and there is excellent results with this. So if any back pain patient comes, accordingly Maharasnadi or Yogaraj Guglu or Gandha Thailam, Gandravastadi, Sahacharadi Gandha Thailam, anything. But the Ushnata has to be kept in check. When you give severe Ushna medicines like Gandravastadi and Sahacharadi, you need to be very careful. So the patient should not develop UTI or gastritis. And so basically, when cut down to the chase, you have to have 3 fulfillments or 3 requirements to choose Gandha Thailam. Number 1, the Vyadhi should be related to Asti Dhatu. The Vyadhi should be related to bone or joint problem. Then you choose Gandha Thailam. Number 2, in Bhagnaj, you choose Gandha Thailam. Number 3, in Kapha Varna. Kapha Varnat Vata Prakopa, you choose Gandha Thailam. In Dhatu Kshayat Vata Prakopa, you choose Ksheerabala.